Welcome, Dr. Bayat. We're so happy to have you today, once more saying this. We are all looking forward to hear all the beautiful updates and on why you're doing what you're doing and all the beautiful information you have for us as an update to what you've already talked about before. I want to give for those who are visiting us for the first time, summary of what the talk is about. So if you want to read the summary for yourself and visit for future events, please go to www.clearwaterbaha'is.org. It is again, www.clearwaterbaha'is.org. You can access all of our live sessions by clicking on the button that is on the screen that says click on me to access the live session. And the biography for Dr. Bayat, we've explained it, but I'll say very quickly. Dr. Vafa Bayat is an MD, PhD. He is a research scientist and physician with diverse diagnostic and basic research training from Baylor College of Medicine and Stanford University in neurodegeneration, genetic diseases, managing complex collaborations on large research projects, financial strategy, business development, mentoring, project development and presentation, computer and analytical skills. Dr. Vafa Bayat is a program head of research and development at healthcare artificial intelligence company, Bitscopic. That's the name of the company, Bitscopic. Presently in its efforts to serve veterans through the development of artificial intelligence tools that will improve healthcare delivery, identify new relationships between diseases and other health-related variables, diagnose COVID-19. So there's more to talk about, which Dr. Vafa Bayat will more than explain. But this week's topic is an update to the coronavirus and understanding of the connectedness of humanity. So without much further ado, Dr. Vafa Bayat, please take it from here.
Thank you, John. That's very nice. Good to see you all on this Sunday morning. I'm open to any questions people have, and I'm very happy to stop at any time. But I have a lot to go through, so I'm going to get started. So I want to say that in this world, we have to have a humility in order to successfully defeat this virus. And to have humility, we have to understand that this virus is actually much, much worse than what we often hear. This virus is extremely, extremely dangerous. So with my medical training and my PhD training and my current work, I'm focused 100% of my time on understanding this virus. And what I've realized is quite shocking. This virus is not like anything we've ever seen before. In fact, I think that it's probably the worst thing humanity has faced since the Black Plague. So I'm going to share just a few of my observations about this virus that you may not hear about in the media or in your own reading, just to get a glimpse at what we have to do as a human race, as a human family, because the only way to tackle problems like this is by global cooperation between people. Okay, so I come to this perspective because I'm a member of the Baha'i community. The Baha'i community is worldwide, with members in every country and locality in the world. The Baha'i faith was founded in 1844 in Iran, and its purpose, as I mentioned, is the unification of the human race, the birth of a global civilization and a golden age, in which principles of equity and justice, the equality of men and women, universal education, and everyone recognizing their inherent oneness in all aspects, from religion to race. This is an example of a picture taken last summer with me and my Baha'i friends in California. And it was a beautiful conference that we focused on these different things. The conference, although not that big, was conducted in many different languages: English, Spanish, Chinese, Persian, and it was really valuable. So COVID-19, it's this term that has just been thrown around like crazy. It refers actually not specifically to a virus. It refers actually to a disease. Uh, a disease caused by a virus. The virus itself is actually known as SARS-CoV-2. It's one of the 7 known human coronaviruses, besides the 4 seasonal ones, SARS and MERS. They were called coronaviruses because of the appearance of a crown on high-resolution TEM, like this picture of the SARS virus published in 2003. So now I'm going to talk about several things which, for me at least, produce humility and a desire to work with others, because I realize that this virus is way beyond anything any one person, any one company, any one country can deal with. And there are a lot of misconceptions everywhere about the virus. First, that it is harmless to young people, that it only kills elderly people with severe comorbidities, that it is just like a cold, that the cure, the lockdown, is worse than the disease, that once we have a vaccine, everything will be fine, that herd immunity will save us. In my opinion, these are all misconceptions. And the reason why I feel they are is because I don't get my information from the media or from public opinion or from others who have conversations with me, as I don't need them, because I only pay attention to the scientific literature and my own direct research into it and its impacts on the body. So I'm going to share with you in the next few slides what my thoughts are on what the real dangers of this virus are. But no one should take what I say at face value. One of the Baha'i principles is that we should all investigate reality for ourselves. We should not depend on anyone else's explanations. But I feel that the scientific literature, although it has lots and lots of flaws, which would take hours to go over if we ever did, it's helpful, because at least there's a scientific method to discovering things. So first, the virus's effect on the body. This virus's effect is like no other I have ever seen. When I was in medical school, I studied 100 different viruses and how they affect the human body. And I never saw something like this. Let's just take its effect on the immune system. When I first read about this virus on January 3rd, when its sequence was first reported by the Chinese version of the CDC, and I studied its sequence, I realized it would inhibit the immune system. And I wrote about it in a LinkedIn article that you can read. It's public. But I think the reality is much worse than I imagined back then, because it seems that a weakened immune system continues long after the virus has resolved. And because this virus has just appeared recently, we don't even know how long it will take for people to recover their immune function. So let's just give one example. So here, this paper is talking about people who recovered in Hubei, which is a province in China that now everyone has heard of. It's where my wife was born and raised. And in this province, you had 55 patients who all caught this virus back in January, and they all recovered and they seem fine. But in this study, they looked at their blood, and they discovered they all have what is essentially a broken immune system 3 months after the virus had affected them. So as a result, not only does that mean that people with the virus have a suppressed immune system while the virus is still infecting them, it continues long after the virus is gone. And that means that everything else, which may be very bad for us, other viruses, other bacteria, other fungi, or rather harmless to an immunosufficient person, could be devastating to humanity over the next few years or decades. The second misconception, it seems, is that young people are immune from the virus and they won't die. This is not true. Even children and infants are becoming very sick and dying. I cannot even count how many young people who, like people in their 20s and 30s, who I am maybe 2 people away from, who have died in the past few months from strokes or heart attacks or from lung damage. It's unbelievable. And if you have not experienced that, you will, because this virus has a terrible effect on young people. And even in children, so there's this inflammatory syndrome. The name for it hasn't yet been totally decided on, but some people are calling it coronavirus inflammatory syndrome. And hundreds of kids are developing this, and they develop all kinds of terrible things. Because it's inflammatory, one of the effects is on blood vessels and on the heart. So their vasculature could be permanently damaged from this. In this one report, there were 300 kids with it. And some of these children are dying, and they were healthy before. Some of them have permanent neurological damage. So the point of this all is not to scare you, but to realize this is bigger than anything you dealt with before. This has an effect on every age group. And recently several reports came out, that the most infectious people are children aged 10 to 19. These kids, they might not be have severe symptoms, but they are probably the most transmissive. Then the next point I want to make, this virus and its symptoms don't just go away for a lot of people. I don't know if anyone's heard this term. It's called long COVID. There's this large number of people growing every day who call themselves long COVID. They've started Facebook groups and other types of groups, and they first had this virus 3-4 months ago, and they've been debilitated for months. They're also called COVID long haulers, and they have so many symptoms, from permanent headaches and muscle aches and fatigue and fever and so on. And physicians don't yet know what's the underlying cause. Do they still have the virus, but it's not very detectable in their nervous system because the virus is neurotropic? It does affect the brain. Or my hypothesis is that it's because the virus has caused permanent damage to endocrine organs like the thyroid, like the pancreas, and the adrenal glands. Because, not to be too technical here, but the virus enters cells via the ACE2 receptor, and the adrenal glands have a lot of this ACE2 receptor, and it enters these endocrine organs and damages them. This is what's being shown gradually through pathology reports. So you're going to have millions of people with hypothyroidism, with type 1 diabetes, with adrenal issues, and so on, after this virus has gone away, has stopped infecting them. And we don't know what the implications of that for humanity. So again, this is something that you cannot ignore it. It has to be faced head on, and people have to work together between institutions, between companies, between countries, because this is bigger than anything anyone can solve. The next I just want to go over briefly is vaccination and herd immunity. A lot of people have put all their hopes that a vaccine will save everyone, and then life will go back to normal. Or that a lot of people will catch it, and then through herd immunity, it will become like the common cold, which ironically is also a coronavirus, typically. And my father is smiling because I used the word ironically. This is probably one of my favorite words of all. And the common cold, the reason why it's common is because there is very little good immunity to it. So you get it every year. Okay? So coronaviruses have this nature. You cannot become immune to them very easily. Okay? In fact, the evidence is accumulating that not only vaccines, but also prior infections cause them to become sicker and even die. Now, I'm not saying this so that nobody goes and gets vaccinated or anything. We don't have enough evidence to say that. But there's a growing number of people who caught COVID-19 3 months ago, and now they caught it again, and the second time they catch it, their symptoms are much worse. And doctors at first, I belong to news groups for infectious disease doctors, and they discuss these things with each other. They discuss what they're seeing in their patients. And there's whole long threads by these ID doctors about that somebody came in after 3 months before having recovered, and they didn't think they still had COVID-19, and they tested, and now the person has a new infection of the virus, and this time they're much sicker. And this is going to happen more and more. Now, what do these vaccines that are being developed, and I'm all for vaccines, but what do these vaccines do? They produce antibodies, a type of antibody called an IgG that is usually against the virus's spike protein. The spike protein is what allows the virus to enter cells. And this IgG binds to the spike, and it forms this complex called the spike IgG complex. And it seems that this complex promotes this hyper-inflammatory response. So what we might find is that after the population is being vaccinated, some people will end up having worse symptoms than they would have had without the vaccine. Or some people who had the virus the first time will develop these IgG antibodies and become sicker the second time. So instead of becoming better and becoming milder, in a lot of people, this virus will become worse. So the reason I want to say this all is that this virus is not something that's going to go away. It's going to trouble humanity for decades, at least. Okay? And it's going to probably affect humanity in very big ways. And the earlier humanity can cooperate to address it, the better. So thankfully, we have this wonderful message brought by Baha'u'llah. which is about the unification of mankind, the unity of science and religion, among many other wonderful topics that can ensure a healthier, happier world if humanity were to follow. We wouldn't have these chaotic and sometimes useless public responses in a world where people acted as one family and cared about everyone else in the world. We wouldn't have had a situation where, because the virus was affecting um, a city in China, the rest of the world kind of ignored it because it was somewhere else. It was in China, it was in Wuhan, which a lot of people never heard of. They would have, from the very first day, paid close attention to it and understood the magnitude. If it was affecting your own family, even if they were in Wuhan, you would have taken it very seriously, right? Actually, it was affecting my own family. My wife's parents live just a couple hours drive from Wuhan. And from the first day, they were affected by it. So I could see it with my own eyes, my own family affected. This is what the world needs. We all need to understand that it doesn't matter where in the world somebody is, whether it's an Ebola epidemic that's currently underway in the Democratic Republic of the Congo, a place which is, again, very far away from the United States, not somewhere where we think about daily. But if we realized that those people were also our family, and they were also sick, and they're just like us, and the virus that affects them will affect us and our family and friends at some point, we take these situations, we take these viruses seriously. So global institutions like the World Health Organization, they are powerless to help mankind prepare for and deal with these types of crises when everyone does their own thing and listens only to themselves. To really address these things, we need unity, we need common purpose, we need concern for the welfare of all, we need consultation, respect, assistance for those who need it, both at the individual and collective levels. We cannot say, for example, that, oh, this virus really only kills elderly people, therefore the rest of society can just, be fine. No, we cannot. They are our family. And if they get hurt, trust me, you will get hurt too at some point. We have to protect everyone, the weak, the strong, and often the strong become the weak. So it's really a big circle, right? Fortunately for mankind, Baha'u'llah and the Baha'i faith arrived recently enough to start a process where humanity starts to unite. Because the threats of the future are very, very different from the threats of the past. Not just from exogenous events, like asteroids and aliens and stars failing and so on, but also from endogenous events. Part of the reason that these pandemics threats are growing so much is because, for example, of the way humanity eats meat and raises animals. They are kept in such dense and huge numbers all over the world to feed us. And because of that monotony, it produces the perfect environments for every type of bird flu and swine flu and now these coronaviruses and so on. We have to rethink the way we live. This is an endogenous caused event. It's not something sent by God. It's something we did ourselves. And only united, concerted action can help us. So when Abdul Baha, the son of Baha'u'llah, came to Stanford in 1912, He gave a talk to the university, and he said the following words: Baha'u'llah especially emphasized international peace. He declared that all mankind is the one progeny of Adam and members of one great universal family. If the various races and distinct types of mankind had each proceeded from a different original paternity, in other words, if we had two or more Adams for our human fathers, there might be reasonable ground for difference and divergence in humanity today. But inasmuch as we belong to one progeny and one family, all names which seek to differentiate and distinguish mankind as Italian, German, French, Russian, and so on, are without significance and sanction. We are all human, all servants of God, and all come from Mr. Adam's family. One of the purposes Abdu'l-Baha came and gave this type of talk was because he knew that the animosity in people's hearts between these different races, like Italian, like German, like Russian, would be the underlying cause of a world war. Never before had there been a world war, and it happened 6 years later. He goes on to say, casting away once and for all the fallacious doctrine of racial superiority with all its attendant evident confusion and miseries, and welcoming and encouraging the intermixture of races and tearing down the barriers that now divide them, they should each endeavor day and night to fulfill their particular responsibilities in the common task which so urgently faces them. Baha'u'llah, in the Hidden Words, says, know ye not why we created you all from the same dust, that no one should, I can't see it actually, exalt himself over the other. Ponder at all times in your hearts how ye were created. Since we have created you all from one same substance, it is incumbent on you to be even as one soul, to walk with the same feet, eat with the same mouth, and dwell in the same land, that from your inmost being, by your deeds and actions, the signs of oneness and the essence of detachment may be made manifest. Such is my counsel to you, O concourse of light. Heed ye this counsel, that ye may obtain the fruit of holiness from the tree of wondrous glory. And on the subject of interracial marriage. So in this story, at the behest of Abdu'l-Baha, this young man, this wonderful African-American young man named Louis Gregory, he came to pilgrimage. He met with Abdu'l-Baha and Shoghi Effendi, visited the shrines, and after returning to Egypt from Palestine, the discussion of race unity in the US came about with Abdu'l-Baha. Abdu'l-Baha stated there was no distinction between the races, and then he gave blackberries to each of the pilgrims, which Gregory interpreted as a symbolic sharing of black-colored fruit. He then encouraged the marriage of Gregory and a white English Baha'i named Louisa Matthew, whose pilgrimage coincided with Gregory's and who traveled to America at his invitation. Although Abdu'l-Baha raised the topic of intermarriage during their visit to Egypt, saying, if you have any influence to get the races to intermarry, it will be very valuable, and so on. So this wonderful couple became one of the first couples, interracial couples, to get married. And the reason I tell you this story is because in our world, we need unity. We need the recognition that everyone is one family. And it's the only way we can fight this virus, but also solve all of the other problems that humanity has. This is another story I shared last time. It's called The Black Chocolate of New York. I'm just going to repeat it because I just love this story. So you had these boys in New York. They were very, very poor. A number of boys gathered in their train, Abdu'l-Baha's train, and soon they became a little too vocal in their expression. As I remember, even some venturesome ones called names and threw sticks. I told them who Abdu'l-Baha was, that he was a very holy man who had spent many years in exile and prison because of his love for truth and for men, and that now he was on his way to speak to the poor men at the Bowery Mission. Now, what do you see here? You see an effect on these children where they became a little bit more humble. Before they were laughing and teasing and joking, and then they said, this is a special man, a holy man, who's come to bring peace. So they changed. That's the purpose of this talk, although very meek and a very meek attempt. The purpose is that people realize that maybe their misconceptions about this virus were not, and so they become a little more humble and realize that maybe something is bigger than they first imagined. One of the boys says, can't we go too? One who seemed to be the leader asked. I think that would be impossible, she told them. But if you come to my home next Sunday, and she gave them the address, I will arrange for you to see him. So here they were. We followed them up the stairs and into Abdu'l-Baha's own room. I was just in time to see the last half dozen of the group entering the room. Abdu'l-Baha was standing at the door, and he greeted each boy as he came in, sometimes with a hand clasp, sometimes with an arm around a shoulder, but always with such smiles and laughter, it almost seemed that he was a boy with them. And this is what we have to be. We have to be like a boy with everyone. It doesn't make you childish. We're not talking about being childish. We're talking about being one of the human race, being a boy, not being different, being one of us, and recognizing everyone else to be one of you, like a boy, like Abdu'l-Baha was. Certainly, there was no suggestion of stiffness on their part or awkwardness in their unaccustomed surroundings. Among the last to enter the room was a colored lad of about 13. He was quite dark, and being the only boy of his race among them, he evidently feared that he might not be welcome. When Abdu'l-Baha saw him, his face lighted up with a heavenly smile. He raised his hand with a gesture of princely welcome. The room fell into instant silence. The black face became illumined with a happiness and love hardly of this world. The other boys looked at him with new eyes. I venture to say that he had been called a black many things, but never before a black rose. This significant incident had given to the whole occasion a new complexion. The atmosphere of the room seemed now charged with subtle vibrations felt by every soul. The boys, while losing nothing of their ease and simplicity, were graver and more intent upon Abdu'l-Baha. And this is what I want for all of humanity to realize, to be a bit graver, to be more intent, and to recognize the spiritual qualities in people everywhere, beyond our own local surroundings. They were graver and more intent upon Abdu'l-Baha, and I caught them glancing again and again at the colored boy with very thoughtful eyes. To the few of the friends in the room, the scene brought visions of a new world in which every soul would be recognized and treated as a child of God. The freedom from just this one prejudice in the minds and hearts of this score or more of souls would unquestionably bring happiness and freedom from rancor to thousands of hearts. How simple and easy to be kind, I thought, and how hardly we learn. And it goes on. I won't go into it too much. I'm going to give some time for questions. But Abdu'l-Baha provided them with chocolates. And one of them was a very long chocolate nougat, a very black one. And he placed it against the boy's cheek. And everyone studied this. And they loved it. And they realized if a chocolate can be so wonderful, why couldn't this boy also be wonderful, right? So here, Abdu'l-Baha, this is the San Francisco Chronicle, he coming to Stanford, an appeal for peace. And here, this is what Abdu'l-Baha says about the races. The second condition is that he must admit and acknowledge the oneness of the world of humanity. By this means, the attainment of true fellowship among mankind is assured, and the alienation of races and individuals is prevented. All must be considered the servants of God. All must recognize God as the one kind protector and creator. In proportion to the acknowledgement of the oneness and solidarity of mankind, fellowship is possible, misunderstandings will be removed, and reality become apparent. Then will the light of reality shine forth, and when reality illumines the world, the happiness of humankind will become a verity. So this is something we all have to struggle with. In recent days, it's really come to the forefront of our minds, the oneness of the races, especially in America after these terrible events recently, but going back hundreds of years, actually, nothing that recent. It's always been going on. So this Baha'i faith has come to teach that these races do not exist in the mind of God. And we have to recognize, acknowledge the oneness and solidarity of mankind. Once we do this, the whole world will become illumined. Okay? Can you imagine? It's like switching on a light for the whole world. And so here, Abdu'l-Baha is speaking at Stanford, which is where I partly got my education. And here he says at Stanford, as this is true of material phenomena, how much more evident and essential it is that oneness should characterize man in the realm of idealism, which finds its expression only in the human kingdom. Verily, the origin of all material life is one, and its termination likewise one. In view of this fundamental unity and agreement of all phenomenal life, why should man in his kingdom of existence wage war or indulge in hostility and destructive strife against his fellow men? Man is the noblest of the creatures. And Baha'u'llah writes, it behoveth man to adhere tenaciously unto that which fellowship, kindliness, and unity. So with that, I'm going to close. I hope that was useful to you. And if there are any questions about COVID-19 or about anything else I talked about, I'm happy to answer.
So the first question, Mr. Ehsan Bayat asked this question. He asked about pregnant mothers.
Yes, thank you very much, John and Dr. Vafa Bayat. A very informative presentation and also rather troubling with the thought of this being around for so long. My question is on mothers that are pregnant and the child in the womb of the mother. What is the prognosis of that for the mother and or the child? Thank you.
Thank you, Sanjay. So this is something which bothers the medical community a lot. There have been a lot of papers about it. It seems that we don't have a good handle on it. Early on in the pandemic, several mothers in Hubei, it was noted that a few pregnant mothers had the virus and transmitted it to their newborn. So this got people concerned. And more recently in the US, several mothers have been found to be infected. There were a large percentage of them in New York, actually. In some cases, like 10% of all pregnant mothers were found to have the virus. But so far, it doesn't seem like pregnant mothers or their newborns have had very serious outcomes. So although it might be quite common, and this might have to do with the fact that pregnancy induces a kind of immunocompromise on its own, and therefore the person is more susceptible to catching a virus even if very few particles are present. It doesn't seem so far that outcomes are bad, but we don't have a lot of examples. We don't know. It's not certain. There was discussion that maybe because the placenta doesn't have ACE2 receptors, at least I thought so initially, that it doesn't transmit, but it does seem to be. But fortunately, nothing terrible has been reported for them. Okay.
So there is another question, and this is from Mr. Edgar Kinsman. Now, Mr. Kinsman asked, is there a change in a new infecting virus? So, Mr. Kinsman, you're able to unmute yourself. Would you like to explain your question?
Yeah, when people get reinfected, is there a mutation in the coronavirus, or is it the same virus that they're getting?
That's a great question. Thank you. So, at first, when this virus appeared, scientists kind of, maybe to reassure themselves, reported that this virus doesn't mutate very fast, and that don't worry, it's not going to mutate. But the evidence now is totally against that. This virus mutates very rapidly. And within 3 months, a major mutation had appeared in the spike protein, which is called G614D. And we don't know where it happened, but most likely it was in Europe, perhaps in Italy. And this may have been the reason why the epidemic in Italy was so severe. And then that virus spread to France, Germany, Britain, but mostly to France and Spain, and then to New York. And it seemed that that virus strain with this single mutation was very infectious, and it has quickly become the predominant strain in the world. So it went from almost 0% in March to now 95 to 100% today. So all viruses, but obviously this one, they are in an arms race against each other, not just to become more infectious and infect more people, but also just to spread in the same person. So based on my analysis, as of a month ago, there were now 12 major strains of the virus. These are genetically different strains, and they're each competing with each other in different places. We don't yet have what's called a genotypic phenotype correlation to be able to say that one virus is worse than another, but it seems that they are each going to have qualities that affect different age groups, different ethnicities differently. And so I can almost guarantee that if you catch the virus one day, and then 3 months later you catch it again, it's probably going to be a different strain. And it doesn't necessarily mean that you won't be able to fight it with the same immune system, but just like with all coronaviruses, they come back. They come back very often. every 3 months, every 6 months. That's why they're the common cold. They're common. But one of the concerns that a lot of the scientific community has, especially in the past few weeks, is the immunity against the virus is very short-lived. For example, a study I read this morning was saying that people who've had the virus, their antibodies disappear almost completely within 6 weeks. So you may not be even a little bit immune to it, even after you've caught it. So that is concerning. So yes, I think we will see numerous types of the strains, and they will keep coming back, and we don't know how strong our immunity is. Ultimately, what I suspect, the way we will deal with this virus, if we are able to take a hold of it, is through a multi-pronged effect. We cannot solve this with a simple vaccine, with a simple antiviral, with wearing masks, with stopping travel. It has to be multi-pronged. It's an invisible, dangerous enemy. And we have to do a lot. It requires unity. It requires unity between physicians, between scientists, between communities, between politicians and global institutions. It cannot be solved by anyone. And if a country decides, announces that it's been so successful in eradicating it, it will be humbled very fast, because this virus will quickly jump back, and cause them to really suffer. So nobody should take pride that our town or our state or our country has succeeded and ignore that other parts of the world have not. It has to be, we have to be successful together everywhere. Otherwise, it's wasted.
So we have another question from Mr. Vafa Bayat, and the question is it possible that once you get the virus, you always have the virus, like herpes? It just goes dormant, and then there's no new reinfection from a secondary virus. It's just the same virus waiting for your body to be weakened to attack. And then further, he appreciated your clarification. No, that was me talking to him. All right, so here we go. I'm going to unmute you to ask your question. One moment.
John, you're so funny.
John, you did a great job. You stated my question very well. Yeah, does the virus, is it always the same virus from the first infection, and there really is no secondary reinfection? I understand there's many different variations and mutations out there, but these testing of antibody screenings, they're not perfect, and this virus could just possibly go dormant in you, and they're not really screening it because it's gone completely dormant, and you may appear okay, and you might not have any symptomology, and you might feel fine, but you still have it, and then it's just waiting like a spider, waiting for your body to be weakened, and then it comes back with a vengeance. Is that possible?
Thank you. Yes. So it remains to be seen, but I suspect that's true for some people. So in the virus world, there's something called a reservoir, where something is kept quietly and then it appears. You can use the term reservoir for a population of animals where the virus is just slowly moving from one animal to another, and then it appears in the humanity out of that reservoir. And one of the goals of virologists is to figure out where the reservoirs of all these viruses are. In the case of COVID-19, most likely the reservoir of this virus is on a type of bat in China. China has more different populations of bats than anywhere else in the world, with more diversity, and similar viruses to this one were found there over the past few years while people were looking for reservoirs. And so, but the reservoir also can refer to a part of the body where it can stay, and it can be dormant, like you said. Some viruses we know have this characteristic, like HIV is one virus. HIV infects you with a very acute infection, then your body attacks it, so it becomes almost gone, almost 100% gone, but it still exists in parts of your body at very low levels, and it's dormant, so it becomes like a reservoir. And then after a while, after a few years, it comes back with a vengeance, like the word you said, and ultimately causes death. So it's very possible that COVID-19 does this in some people. I've seen reports of people who caught this infection 3 months ago, and they still have low levels of the virus today. So that suggests that they kept it, maybe in a part of their body, maybe in their brain, maybe in their liver or somewhere else in a reservoir. I've seen a lot of reports coming out of Hubei where people, they recovered from the virus and their PCR levels went down to almost nothing. They were asymptomatic for 3 months, and then in these serology studies afterwards, doctors discovered low levels of the virus still in their blood 3 months later. That argues that that in some people there is a reservoir. So if you take these things together, I would say yes, most likely the virus is hiding in parts of your body for long periods of time, and it could stay there forever. And it wouldn't be the first. There are many herpes viruses uh, um, that stay in your body your whole life. So it's quite possible.
That is amazing. I mean, learning all this information, it's amazing. There is a question from Susan Jeffers. She has a few questions, such as the importance of wearing a mask. What is your take on masks and such?
Sure. Yeah. A lot of the public discourse has been on masks. A lot of the governmental discussions, doctors, public health authorities, everything has been about masks. Not that much actually about the virus itself. It's more about how to protect people, which makes sense. You know, I know a lot of clinicians who treat COVID-19. I'm a clinician. I'm a medical doctor, but I don't practice. I deal with data, vast amounts of medical data, millions of patients. That's what I study every day. But clinicians who actually physically deal with patients, it's now very clear that even if they are treating COVID-19 patients every single day, as long as they consistently wear a mask, they reduce the likelihood of catching it by like 99%. Very few doctors at Stanford who've been treating hundreds of these patients for the last 4 months have caught the virus. And the only thing they were really doing was wearing a mask and washing their hands. So it is true that this virus has at least 10 different ways it can infect people, but the most common by far is through respiratory droplets, breathing in. And these masks, it doesn't even matter if it's not a very good mask. As long as its filtration size is small enough that it captures these fairly big respiratory droplets, you will be fine. So I always wear a mask when I go out. But I also wash my hands, and try not to touch my face. But, you know, you can only reduce risk so much, because sometimes you just have to, you know, go on faith. So.
So there is another question from Miss Regina Colston. She asked, is there a role melanin can play in preventing the virus in the Black community?
Okay, melanin. All right.
I think she's here with us to clarify her question.
I think I need a little clarification.
All right, Regina, please, I've sent you a request to unmute yourself. Regina?
Yes, I have a friend who is a food biotechnologist, and she is doing some research on melanin. And she suggested that it might prevent it in the Black community, but as the disease progressed, we saw that that really wasn't true. And I was wondering if there was any consideration of melanin in addressing the issue of the coronavirus in the Black community.
Okay. Yeah. First, unfortunately, very sadly, African Americans have been hit very hard by this virus. So there are three populations in the US which have been hit harder than anyone else. First is African Americans, second is Hispanics, and third is Native Americans. These are three groups of people that seem to be very, very vulnerable. We don't yet know the reasons why, but often when you have a situation like that, it may boil down to blood types, not necessarily pigmentation of your skin, but blood types. For example, it's now clearly increasingly being documented that people with type A blood are much more susceptible to the virus than other blood types. And it may be that those blood types, I haven't looked into it, are more prevalent in those populations. However, in regard to melanin, melanin is a very interesting substance. It's related to dopamine and serotonin, and it's produced by these cells called melanocytes, which are present in the skin but also in other organs. And these cells, they have these tentacles kind of that spread through the skin, and they deposit this melanin substance around and on other cells like skin cells, keratinocytes. And this causes the skin to be slightly pigmented. And there are different types of melanin, each with a different color, but generally they're most common is black. And I don't want to go into all this stuff, but melanin is basically protective against sunlight, but it's also protective against other things like oxidative stress. And cells in the immune system, they also use melanin and related substances to attack bacteria and fungi and so on, because it can kill those things. But my suspicion is it's not going to play a big role in fighting the virus. But I don't know. I'm not a melanin expert.
So there is a question from Susan Jeffers regarding how this virus would affect people who are generally living healthy lifestyles, not people who already are stressed or they have damage already or they are maybe taking medications already. What about people who treat their body according to current scientific knowledge correctly? They treat their body right. What about those people?
That's a great question. It seems that in general, people who are healthy and they don't have what's called a comorbidity do much better with this virus infection. In general, they recover faster and they do better overall, with less problems afterwards. Another train. However, there are hundreds of examples I've read of young people in their 20s, 30s, and 40s with nothing wrong with them who have even died from the virus. Because sometimes when you're very healthy, you have a very strong immune system, and the virus has the worst effects on two types of people. The ones which have a very poor immune system and with a lot of other health problems. And it also has a bad effect on people with a very strong immune system because it can attack their own lungs very severely. So no guarantees at all. You can be healthy, you can not, and you can still suffer greatly. In fact, most of the people who are these so-called long haulers or long COVID patients were previously completely healthy, and they've been suffering ever since for the last few months with this virus. And so no guarantees in life. The purpose of my talk is to talk about how we all should cooperate, unite, and have a common focus, but also realize that there's a lot of uncertainty, and we have to live with it. We don't know what's going to happen, and live every day to the best of our ability. Okay.
So I have another question for you. So this question is from Mr. Ehsan Bayat, and his question is, if you suspect you have COVID, what is the best thing to do?
Well, first you should avoid infecting other people. You should definitely wear a mask yourself, and you should seek medical treatment immediately and take the advice of your doctor. You should monitor your symptoms over time, note anything which seems out of the ordinary, and let them know. You should just do basic things which make sense, like stay hydrated, continue eating, take vitamins, and rest and say some prayers, and hope that by the time you catch it, there will be better medicines available.
Thank you. Thank you.
Thank you for that. There's another question. Mr. Ehsan Bayat, did you have another question on this, or he answered it?
Let me rephrase my question. So the only way that you would know you have something wrong is obviously if you have symptoms. And the most common symptoms for COVID are, breathlessness. Could you list some of the symptoms so that obviously we could look out for these? And also, could you, which one are the most common symptoms for COVID?
Sure, happy to. So most commonly you have fever, you have a cough, you have muscle ache, a headache, and sore throat. These are the most common symptoms. if you have any combination of these this summer, most likely that's what you have. It's also been noted that a large percentage of people have a loss of smell. And this seems to be a common theme that, for example, people who study Google Trends, they've noticed that if people ask on Google, I've lost my sense of smell, and a lot of people in the area ask this question, that area will probably see the next wave of the pandemic. So it seems to be a way to catch it. But then more rarely, you also have diarrhea. You have other symptoms. And there's
Question, Vafa, sorry to interrupt. Say you've had these symptoms before, like for example, the president of Brazil, President Bolsonaro, he's had those symptoms before, and he comes back later and says, hey, I had this COVID, but I wasn't even aware of it, you know? Would you be aware that you have had it, or is just like, oh, I have a fever, some muscle ache, and then the next few hours I'm okay, I had some Advil, the headache's gone, and back to normal? Or is it so bad that it's pretty obvious and you got to go to the hospital, or it's case by case?
Yeah, everyone responds differently to the virus. So I would say it's a case by case basis. Yeah. There's no blanket approach you can take. Some people catch it, recover quickly. Some people catch it, they end up in the hospital, and they can be in the hospital for 1 or 2 months and then die. Some people catch it, go home, and then feel sick for the next 3 months. It's a very variable disease.
One last question. Sorry, John. One last question. If you catch it, right? If you catch it, could you pass it on even after it's per se gone in your body, you know? This quarantine, you know, of 14 days, you know, and you don't have any symptomology, but you don't even suspect that you've had it. You've had a fever and you've had headache and all that business, and then there's no other symptomology. Could you still pass it on even after it's per se gone? Or when is the point that you can return to normal? Because I've even seen reports of people 40 days, 60 days still having it and living with it.
Right. So early on, 2 or 3 months ago, there was a report that there was a lady, a South Korean lady, who visited Wuhan and then came back to South Korea and was tested multiple times. And then she started developing a fever, and she was discovered to have the virus, which was 40 some days after she left Wuhan. So the virus in her was actually hibernating for, 7 weeks before she started showing symptoms. Initially, when epidemiologists studied the disease, they concluded that on average, there was an incubation period of 5 to 10 days on average, where you catch the virus, it slowly grows in your blood until you start showing symptoms after 5 to 10 days. But now we know that although that's a reliable average, some people like her could have an incubation of 20, 30, 40 days easily. Now, regarding whether you are still infectious after you've had the symptoms and you've recovered, yes, it is possible. Anything is possible. However, it seems that you are most infectious in the initial incubation period and in the first 2 or 3 days of symptoms. After that point, you become much less infectious, much less. So yes, if you still have any symptoms, sure, you could still pass it on in some way, the likelihood goes down dramatically. And even if you still have the virus in your blood after 2 months, it's doubtful that you will still be infectious, even if you still have it, because the infectiousness comes from the initial infection period, where it infects your throat. Okay? Once the throat has cleared and the virus has gone into your blood, you cannot spread it very easily because no one comes in contact with your blood. They come in contact with the air you breathe out. Once that infection is cleared, you're much less. But not to say it's gone completely, but much, much less.
Thank you, Dr. Bayat. The next question we have is about people who gather or want to understand the effects of massive gatherings on the infection rate. So as you're aware, in different parts of the world, people are a little bit unhappy, and we may, as a result of protests and people coming together, possibly be spreading the virus in that way. For those people who are, I guess, becoming, we could call it, more active on social issues with large groups, would you agree that the solution, as you had presented in the first talk, it was that we distance ourselves and quarantine, and now people are not really quarantining? How would you go about advising these people who are gathering in large groups?
Well, first of all, somebody who gathers in large groups is probably not watching this show that much. You know, they may not worry about things that much. But in answer to the question, many times over the past few months, we've noticed that when a person arrives in a large group and they're infected, that group often becomes very sick. So for example, there was a lady who went from, South Korean lady, who back in February, she visited Wuhan, and she had cold symptoms, not very severe, and she went back to South Korea, and she was a member of a church that was very active and had lots of different buildings in different parts of South Korea. And she didn't take any precautions. She just went from church to church over the next few days. And then she went to a couple of hotels, and she ate at a couple of restaurants. And this single lady was probably the main cause for South Korea's biggest outbreak to date, because each of those churches had 1,000 people in them, and hundreds of those people became sick over the next few days until it was eventually traced back to her, having come back from Wuhan. And then you had a couple of people getting on board one of these cruise ships, like the Diamond Princess is one that comes to mind. And they unknowingly were infected. And within a few days, this cruise ship ended up having thousands of cases. And there were about 6 of them in the first month, where somebody enters the cruise ship and it became very dramatic. And the world's attention was facing these ships. It's becoming very obvious that infectious rates become very, very high in closed indoor worlds. They can be office buildings, they can be churches, they can be schools. There's a lot of discussion in the media about how schools are nothing we should worry about that much because children aren't affected. And so along those lines, Israel, for example, 2 weeks ago decided to open up its schools again. because the virus had not really been that big of a deal there. Not that many people had caught it. So they thought it was safe enough to open the schools. And they immediately had to close them because an outbreak grew in one of the schools to such an extent that the country was shocked. So I think it's pretty clear that anywhere you have a building where people congregate in numbers, you will have massive outbreaks. I don't have the same data about people who congregate outdoors. It's probably less risky, but it's all about numbers of people. So I don't know how these protests affected things, but I do know that the general reduced distancing is the main cause for the current situation. Like 56% of people when polled in America say they don't always wear masks in public. So even if some people do always, it doesn't really matter, because the ones who are not, they will spread it fast enough that we will all catch it. It's something that requires unity, concerted action. Some people do it, some people don't. It's as if everyone didn't. So we have to be very cautious.
So a last question. Someone had asked about the mortality. Based on the current data, how many people do you expect to die by the end of the year in the world?
Yeah, there are a lot of people who are better at predicting these things than me, that's for sure. I am no mortality expert, although I do a lot of mortality statistics and morbidity predictions, but I'm doing it on people who have a lot of comorbidity in the VA system. Mm-hmm. That's what my analysis is. And it's a different population from the rest of the world, different age group, different everything. So first of all, mortality changes based on age. Mm-hmm. If you are elderly with comorbidities, your mortality rate might be up to 20-25%. If you are young, it could be as less than 1%. Could be less than even 0.5%. But to predict the whole world situation requires too many variables for me to give it even an estimate. I don't know, but it could be millions. There's been a lot of discussion recently about how death rates have been going down in the US. But the problem with that data and interpreting that data in that way is multiple. First, there is a lag. There is a lag between when you have an infection and when somebody dies from the virus. And that lag is estimated to be at least 26 days. So if the infection rates are very high today, we will not see the resulting deaths for 4 weeks from now, at least. So we cannot say today 10 people got infected and 0 people die, and therefore the rate of death is 0%. No way. You have to wait until those people have gone through their illness and then see how they did. So there's a 26-day lag, first of all. And second of all, there's another problem with analyzing things like that. It's called Simpson's paradox. Simpson's paradox occurs when you sum the number of cases and the number of deaths over a large geographic area. And some areas are experiencing rising infections, and some areas are experiencing decreasing infections. And when you sum them, you get this paradox where the data is uninterpretable. So you cannot say that actually deaths are going down, because this paradox means you're adding things to negative numbers, basically. And as a result, the numbers are meaningless. What you have to do is you have to take an area, you have to look at them individually. An area like Texas, where the number of cases is rising, and then there's a lag in cases of deaths rising of a few weeks. And then you see this is what's happening in an area like that where the infection is growing. And you have to separate it from somewhere else. But because that is difficult to do, even intellectually, people like to group things together. Because Simpson's paradox always makes the numbers look better than they are. And people want to feel comfort that things are improving. They want to look for the silver lining. It's a natural human tendency. And so they will grasp it and they will declare it. And they will say, I don't want to stay home anymore. I need to work, which is perfectly reasonable. But that's the issue with using that logic.
And I think that's a very good point that not only the question was asked, but the answer of this kind was given, because it makes people realize, and we can really frame the progression of this pandemic, how it's going to continue from here on, and what steps that we need to take, steps that are not short-term, short-sighted, and limited to the next few weeks. This is something that's going to be very long. And
Yeah.
we're a long haul.
So beyond thinking about the things I brought up, I would suggest that people continue to read about the virus, especially the scientific literature, not just newspaper articles or what your friends say or something. Try to understand what the science says. And in terms of our daily life, take precautions, because you don't want to catch something unnecessarily, which could debilitate you for several months, endanger the lives of your family and friends, and you may never recover from it. There's a lot of talk about asymptomatic cases, people who catch the virus and then recovered, and they never showed any symptoms. But when you really look at what happened to them, when radiologists take 100 of these asymptomatic people and do CT scans on them, it seems 60% of them have permanent lung damage, permanent lung fibrosis. So even though those people think that they got out of it without anything wrong, and therefore they were fine, their lung function may be damaged for the rest of their life. So this is not something you want to catch. So take precautions. It protects you, it protects your community, it protects your family. It doesn't mean, however, that you have to avoid people. You know, there are things you can do that still allow you to see your friends and family in person. So one concept that is being bandied around and is becoming more and more mainstream and scientifically sound is this concept of a pod. A pod is a small group of people. It could be 2 or 3 families or a group of 6 or 7 friends that agree to exclusively spend time physically with each other and not interact widely with other people. And as long as all of them are healthy and they haven't caught the virus and they spend time exclusively with each other, the risks to the larger community are very low, right? So, I mean, you may want to consider creating your own pod of a few friends. And as we manage to vanquish the virus through united efforts over time, the size of your pod, so-called pod, could grow slowly over time to include more and more people. But I mean, these are what we can do.
Thank you, Dr. Vafa Bayat. That was very, very helpful, this whole explanation that you just gave right now. It was very helpful, so people know moving forward something that can be done, and more importantly, a way to not just live in fear, but live with a sense of understanding, wielding this knowledge to, with courage, move on into the future that is still that long haul that's ahead. And it's a good thing, though, that people can apply what you're talking about into their lives practically. And it's not just, not just fear mongering, which a lot of people have been saying a lot of different things about the virus that may or may not be true. But here we have you as an authority coming in and helping us understand and learn to live with that knowledge again and not that fear. And it's extremely important and valuable that those who are watching today, that you share this understanding, because it's extremely important that people, again, come to an understanding and they look to the root of the information. And Dr. Bayat, please, again, for further updates, we welcome you and we look forward to having you again once more. As we've had you before, we have you today, and we look to bring you in some more.
I'm happy to. Okay.
All right.
Good to see you all. Thank you. Hope you have a wonderful Sunday.
Likewise. Bye, everyone.
Bye-bye.